Well, this morning we've woken up to a major health scare. It's been decided in France that a specific breast implant, PIP, which we knew was open to some very serious questions about its manufacture. It now appears that the French government have become aware of some serious side effects from this implant in terms of producing breast cancer, and are recommending that patients get in touch with their doctors and consider having these implants removed. Now, the first thing to say is that in any woman, the chances of her getting breast cancer, depending on what statistics you use, are either 1 in 10 or up to 1 in 14 ladies will have breast cancer. So 1 in 10 or 1 in 14 ladies who've had a breast augmentation or implant, unfortunately, over time will develop breast cancer. So the problem is there an increased risk? Historically, we know from very good evidence in the United States that ladies with a silicone breast implant actually have a lower incidence of breast cancer, and that's been accepted through all the recent studies on silicone and health. So whilst it's alarming to hear that a small number, about 14 ladies in France have developed breast cancer, out of about 60,000 ladies who've had the implants inserted, it probably doesn't represent an actual increased risk. There has been also one case of a very rare lymphoma. And in fact, if you look at the world literature, there have been a couple of further cases of lymphoma reported, not associated with a PIP implant. On the other hand, we do know that the PIP implant was very cheap. Certainly patients that I have seen, I've never inserted a PIP implant, but patients that I've been asked to see do get a very vigorous scar formation around the implant, and they appear to rupture much sooner than better made implants. Now, the PIP implants were just a liquid silicone. Some of it was medical grade silicone, but unfortunately, some of the silicone that was used, particularly in the latter part, was industrial silicone used for other purposes and not of a medical grade. It really is important that patients do adequate research about their surgeon and the company, and of course the implants that are going to be inserted into them. Many people go for the cheapest option, and that's so sad because you get what you pay for. And if you do go for the cheapest, which isn't the best value, then you're going to have a poor implant inserted, and every implant, be it a hip implant or a heart cardiac pacemaker, all implants, including breast implants, need maintenance. So you need to know that your surgeon is going to be around for 5 years or 10 years to advise you further when these sort of scares happen. So the cheap French implant was imperfect. Unfortunately, because it was cheap, it is what the many commercial clinics in this country decided to implant in their patients. Now, I think we can reassure patients at the moment that the risk of getting cancer from these implants is unproven. But given the questions and answers that we're getting from France, we shouldn't treat our patients any differently in this country to what's happening in France, and they're being recommended that they should have their implants removed. So I would say to ladies, particularly those who know that they have got PIP implants in, And if you don't know what implant you've got in, then you should get back to your surgeon, and if he's not around, to the clinic where you had your implants inserted, or the hospital. They will have records of what had been put into you. Find out first of all what implant you've got, and then ask to see a surgeon to get advice as to what you should do further. And unfortunately, what's going to happen in this situation is that many patients are going to be left high and dry without a surgeon to advise them, and probably with a company that will take no responsibility. Ultimately, the surgeon is responsible because he operated on you. And that's what hasn't happened in this country. It's been deflected to the manufacturer. So the order of seeking recompense should be firstly through the surgeon, secondly through the company that distributed them in the United Kingdom. So that will be the commercial clinic, and then the company that the breast prostheses were bought off. Because most of these implants were inserted through the commercial clinics, you're going to find in many cases the answers difficult to get and the advice even more difficult to get. And we will help you if you get hold of Simply Better Breasts by ringing them or getting through on our email, which I enclose on this YouTube. Then we will promise to get back to you and advise you further as to what you can do. For more information, please email us at info@cosmeticsurgerypartnersuk.com or telephone us at 0207 486 6778.